Hello everyone, welcome to this session. Today we are going to discuss the posterior cranial fossa. Previously we discussed the anterior cranial fossa, the middle cranial fossa, and today we are going to focus on the posterior cranial fossa. The posterior cranial fossa is the deepest of the three cranial fossae, and it accommodates the brainstem and cerebellum of the brain. The posterior cranial fossa has three bones: the occipital bone and the two temporal bones. So those are the bones that make up the posterior cranial fossa. The posterior cranial fossa has three borders: the anteromedial border, that is formed by the dorsum celli of the sphenoid, the anterolateral border, that is formed by the superior border of the petrous part of temporal bone, and then the posterior border, which is formed by the inner surface of the squamous part of the occipital bone. The posterior cranial fossa, the floor is made by the mastoid part of temporal bone, the squamous part of occipital bone, the condylar part of occipital, and then the basilar part of occipital bone. The posterior cranial fossa has three paired foramina: the internal acoustic meatus, those ones are paired; the jugular foramen are also paired; and the hypoglossal canal, those are paired too. And then it has one unpaired foramen, which is the foramen magnum. The hypoglossal canal, it is also known as the anterior condylar canal. This one transmits the hypoglossal nerve. Foramen magnum. The foramen magnum is divided into two compartments: an anterior compartment and a posterior compartment. The posterior compartment contains the medulla oblongata, that is somewhat centrally located, and anterior to the medulla oblongata we have the anterior spinal artery. Posterior to the medulla oblongata we have the two posterior spinal arteries. On the anterolateral aspect of the medulla oblongata we have the two vertebral arteries, that is the right and left vertebral arteries. Posterior to the vertebral arteries, we have the spinal roots of accessory nerve. So those are the contents of the posterior compartment of foramen magnum. Anterior compartment of foramen magnum, it contains mostly ligaments. So the most anterior structure in the anterior compartment of foramen magnum is the apical ligament of Dens, followed by the upper longitudinal band of the cruciform ligament, and then lastly we have membrana tectoria. The jugular foramen is located on either side of foramen magnum. It is superior to the hypoglossal canal and inferior to the internal acoustic meatus. The jugular foramen has 3 compartments: an anterior compartment, middle compartment, and posterior compartment. The anterior compartment contains the inferior petrosal sinus. The posterior compartment contains the sigmoid sinus. The middle compartment has the glossopharyngeal nerve in its own sheath. It has the vagus nerve and accessory nerve. Those ones share one sheath. So those are the compartments and contents of the jugular foramen. Now we have the internal acoustic meatus, also known as the internal auditory meatus. The internal acoustic meatus is an oval opening that is located in the posterior aspect of the petrous part of temporal bone. It is going to transmit 2 nerves, the cranial nerves. It transmits facial nerve, which is cranial nerve 7, and the vestibulocochlear nerve, which is cranial nerve 8. The internal acoustic meatus also transmits the labyrinthine vessels, that is, the labyrinthine artery and vein.